Hello, everyone. Welcome back to TMI Talk with Dr. Mary. I'm your host, Dr. Mary. In this episode today, I am joined by Jeremiah Rangel. We break down emotional patterns, trauma, and survival strategies that get stored in the body, and how most people are unconsciously running their lives from old programming and they don't even know it. A little bit about Jeremiah. Jeremiah is a master life and business coach. With over 26 years, he has successfully helped 7,000 clients, connecting them to their internal guidance, divine connection, and deeper understanding of how their mind psychologically impacts health, wellness, and success in life. His specific skill set comes from an extensive background of traveling the world to gather tools, techniques, and strategies that profoundly help to heal chronic illness in a holistic way. When a person has tried everything to heal, but nothing has worked for them, that's when they find Jeremiah to do the deep inner spiritual and psychological work that rescues the younger parts of themselves that are demanding attention through physical ailments that are stuck in the past. What you'll learn from this episode is pretty insightful. We're going to be talking about how the body stores emotional and subconscious patterns, why your nervous system might be the driver behind your behavior even when your brain disagrees, what NLP is and how it helps rewire limiting beliefs, why some people stay stuck in that survival mode and it doesn't matter how hard they try, they still stay stuck in it, how to spot when somebody or yourself is living in a old subconscious programming, why regulation and safety are the foundations of real change, how to create alignment between your body, mind, and future self. And finally, practical ways to start listening to what your body has been trying to tell you. Without further ado, we will jump into the next episode. Welcome back to TMI Talk with Dr. Mary, where we dive into non-traditional forms of health that were once labeled as taboo or dismissed as woo. I'm your host, Dr. Mary. I'm an orthopedic and pelvic floor physical therapist who helps health, movement, and rehab professionals integrate whole body healing by blending the nervous system into traditional biomechanics to maximize patient outcomes. I use a non-traditional approach that has helped thousands of people address the deeper roots of health that often get overlooked in conventional Western training. And now we're going to be starting our next episode. Well, thank you for being here, Jeremiah. I'm excited to chat with you.
I'm excited to be here.
Yeah, we're going to nerd out on a lot of different things. So excited about it.
Absolutely.
Yeah, so let's go ahead and dive right in. Can you explain what NLP is for people that have never heard of it before?
Absolutely. So I'm going to try to do it as succinct as possible. So traditionally, NLP stands for Neurolinguistic Programming. And so neural is like the neurons of the brain. But basically, like pretty much everybody's seen like scientific where they hook up like electrodes to the brain and they see if they have certain anger responses. There actually is like a pattern that fires, like biologically. So through language and through communication, we actually can redirect like a pattern. If anybody gets triggered, so to speak, there's some sort of stimulus, someone says or does something, and then all these things happen and the person behaves in a specific way. So basically NLP, neurolinguistic programming, can reprogram the person's response. It's not exactly like, oh, we saw the trace go here and we're going to move it there. It does actually go to a different place. But this started in like the late 1980s, but it's evolved since then to like when I started learning, it was called neurolinguistic psychology, which is a group of like psychologists, psychotherapists went and studied this, I call it Generation 1 NLP, where they had no really psychological background. It was two gentlemen. One was a mathematician, one was a professor of linguistics, the University of Santa Cruz. They basically nerded out. They got together and they said, they started to like study with three of the most profound psychologists, psychotherapists in the world. And there was like Milton Erickson. He brought hypnotherapy to the mainstream and he did it conversationally. It's not a classical hypnotherapy, how people think like you're getting
Yeah, they
sleepy
think
and
that. Yeah, the little thing.
yeah, which is called authoritarian hypnotherapy, which is basically telling people, but the majority of people don't like being told what to do, so it doesn't really work well. But he actually did it through conversation. It was more like it was permissive. He's like, you may or may not be experiencing a sense of relaxation now, but on a deeper level. So he would just kind of start speaking and people would transform. But he had a psychology background. So these two gentlemen went and actually, basically say, how do you get all these results with people? And Milton Harris was like, I don't know. And they basically said, can we like sit in and document? And they said, sure. And then they did, and they came together with like, here's the patterns of what you did. Then they started to repeat the structure of patterns of what he did, and it started to produce results.
Oh,
And they
wow.
studied with two other people. One was Fritz Perls, who brought Gestalt therapy. So there's just different, like most people that are a psychologist, psychotherapist, they go to college and they study from people who wrote a book or learned from other people. Well, the people that actually did produce results, that's who that NLP was studied after. And so there was just like, instead of putting labels on people, it's actually more helping people take the labels they already put on them. So that's where the NLP came from. And then where I learned it was from these group of psychologists and psychotherapists that went and studied this thing that's not technically psychology, even though psychology is the study of the mind. So it is psychology. And they learned from people who were getting tremendous results that were healing, upgrading, solving problems that a lot of people in psychology couldn't, or Western medicine couldn't. And so these therapists learned from them, and they said, okay, well, it's these on some level. I'm going high level, but these guys are kind of treated. It's more disconnected masculine energy, so they're just kind of like treating people. The mind is the most advanced supercomputer that ever existed, but they're treating people like computers, like just do this, 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 this. So these therapists and psychologists like said, we're going to put some traditional psychological principles, not the labeling, the diagnosing, but like the hierarchy of needs is really, really important. There's just certain fundamental things with psychology, the difference between the unconscious and conscious mind. Those are really important to know. So they started to add and created humanistic neurolinguistic psychology, which is these transformational tools and techniques that came from psychologists. And then they added some other things. So it's more soft, a little bit more heart-based.
I love that because I feel like in Western medicine, so much is telling people what to do
Yeah.
versus having a conversation and getting them to almost realize versus because like I said, I don't know anybody that's actually likes to be told what to do.
Yeah.
I mean, if you tell somebody what to do, at least in my experience, they just kind of like,
Resist.
resist. Yeah. And also in the way you say it too, people can ask for advice and guidance. That's different. But where I have actually seen from a physical therapy standpoint, people don't do their home exercises. Like they just don't do them. But yet we keep prescribing them like across the board as if that's it. And then we're not questioning, well, why aren't they doing them? Like this isn't just
I can tell you why.
well, yeah, I'd love to jump in there
Yeah.
for a second. But yeah, so then I started realizing in my experience, and I'd love to hear what you have to say about it, is if we have to teach the people about the body first and explain to them so they can visualize why it's happening, so then they're likely to do it. Because there's some mental block that's limiting them, and I'm excited to hear what you have to say, but in my experience, if I teach somebody about their body and show them how to move and have them really feel it in their body, that is what takes them to the next level, not these thoracic rotation exercises 3 times a day forever, right? Because I've never seen anybody continuously do them forever. But when you teach them movement and you teach them how to be in their body, that's been a game changer. But I'd love to hear why you see people not doing their exercises.
So if you think of the general population, so most people, they walk around and they're not injured, so to speak. And so what I've learned from years of being a corrective exercise core specialist, like I've put movement down into there's 5 different categories. So there's the lowest one is called occupational therapy. Somebody gets in a huge like car accident, wreck, quadriplegia, try to have the brain through the nervous system, try to like get the toes to moving. So basically it's like you gotta essentially learn how to walk again. Then there's physical therapy, which is the next level up, which is not the whole body or half the body. It's isolated. It could be a knee, it could be a shoulder, it could be, it's just, I'm just, speaking generalizations, but it's more isolated where it's kind of like if occupational therapy is like kind of in a way the whole body or just a lot of most of the body, this is more like this knee, or this hip, which is a really big deal. Then the next level up from that is what I did was corrective exercise. So basically you don't need physical therapy or you're on the border of physical therapy, but you need to like certain muscles are overworking, so they're short and tight. Other muscles, the opposite of the muscle, is long and weak. So we got to correct that. Once they do that, then it's called functional training, choose multiple joint movements, and then there's like peak performance like CrossFit and stuff like that. So the general people, they don't, it's not taught in school.
Oh
There's a
yeah,
gym
it's
class,
not.
climb a rope or
Yeah.
whatever, do jumping jacks. But so most people, from a psychological standpoint, they don't have the file in their mind. If you like, just like a phone, they don't have the app on their phone. So if a general physical therapist, so this person comes in, I have this injury, I don't know what to do, I'm debilitated at some point, but I do need help. Okay, so they make the appointment, they come in, and then if the physical therapist has these technological, anatomical words that the person has on a file for, they don't fully understand. Like like anterior pelvic tilt, like, like quadratus lumborum, like all these different things, like what? And so the more the physical therapist says words that they don't understand, they don't have that file for it. That's one thing, like from a comprehension level. The other one is people need attention. Like people don't realize there's three different kinds of attention in life. There's positive attention, which everybody ideally loves, but most people don't know how to get it. And then there's negative attention, which is better than no attention. Most people, like, they would rather get negative attention than no attention. So when there's an injury, and sometimes from a spiritual or an emotional level, the reason why people get injured is because they actually need to pay attention, but they can't solve it for themselves. So they're hoping to get a practitioner or whoever they're helping to actually pay attention to them. Now, if I injure my knee and the universe brings us together and you actually give me attention, that's great. It's actually going to start not only healing this, but there's a deeper emotional part too. But if you say words I don't understand, okay, that lowers my retention. And then if you're like saying, let's do an anterior pelvic tilt, like I didn't know what that was before I knew what it was. But if so, I want you to, like, lay on this bed, and then I'm gonna put my hand on your low back, and I want you just to squeeze. I want you to flatten out, try to like crush my fingers. So say words that are simple. Don't talk to when I talk to children, I don't talk to them like, hey little guy, hey little buddy. And even if it's a baby, I mean, if it's a real baby, that's fine. But like a 2-year-old, I don't talk to 2-year-olds like like how most people talk to 2-year-olds. I talk to them like a being that's 2 years old, and I speak words that they can understand. And so I don't like, I'm gonna simplify. I don't like put a limited frame on it. Well, I did that with my clients too. It's like I know these technical things. If I'm talking to MDs, if I'm talking to physical therapists, I'm gonna use the language. Like you're getting a rapport. I'm not gonna do it with my clients unless they ask. I don't give technical things unless my clients ask for that. What's the technical word? What does this muscle do? Where's the insertion? Where's the origin? Like they don't really care. They want the result. So I try to simplify it, use metaphors, visualization. That's what gets people to anchor it in their mind. Then they can do it.
I love the way you articulated it, because I feel like, because I've noticed in the past few years, as I've started more, not just focusing just on home exercises. Yes, they can do these stretches to do things to get in their body, but teaching them how to move and understand the why, I feel has been such a game changer. And then, yeah, but it's not taught in school how to break stuff down. So it's also hard for maybe a new grad to come out and they're just trying to figure out how to even, just be a physical therapist. Now you've
Mhm.
got two languages to speak.
Yep.
And if you're only used to speaking English,
Yep.
right? Your linguistic brain isn't typically used to having to break it up into two different things. And so I think I think what it does is it causes, what I've seen is almost causes a rift, because if your body language is off, if the tone of your voice, and then what you're saying too, right? So I think energetically we don't even realize that we're actually causing a lack of rapport when we're
Yeah.
doing this.
And you know why?
Why?
Well, because you're taught, like as a physical therapist, you're taught like anatomical things, and you're not taught how to translate that to normal people.
Yeah,
I can sit and
exactly.
talk to you about NLP. I can talk to you about what a driver is, well, I was going to start to speak some neuromuscular adaptation, but that's not it. But I was going to say, like, I can talk to you what a driver is, what a submodality is, what a transderivational search is. And you're going to be like, huh?
Yeah.
Because you haven't learned that. And there's something that's strange in the collective consciousness of adults where they feel it's usually around like 35 or something. But when adults get to a certain age, they think like, I'm at this age. Why haven't I learned it yet? Why haven't I learned this yet? Why don't I know that? And I say, how can you learn anything you have not yet learned? Like, you haven't gone through that yet. So I can say words that you've never heard. It would break rapport.
Yeah, exactly. There's so much about how our energy is. I say I've been saying this a lot. Is just how our energy is our first treatment. Because if we break rapport immediately and we're using these big fancy words, well, how much of that is A, that we're not taught, but B, how much is ego being like, look at me with these big
Yeah.
words. And then C, it's like that doesn't stick. And I'm not gonna lie, like my brain works in a different way. I actually don't like to use the big words first, even when I'm learning. I don't know if that's just how I am or being ADHD. I feel like a lot of PTs tend to be ADHD too. And I like to learn the concept first, and then let's add those big words later. Even from a professional standpoint, I'm like, yeah, let's break it down. Okay, well, I mean, yeah, some basic terms, but if you're constantly like using these big terminologies with people, even while they're learning something new as a clinician, that doesn't mean that clinician's not smart. I thought that about me for a long time because I was like, I don't get these big concepts. But then once I had them broken down, sometimes I'll even go onto ChatGPT and be like, explain this like I'm 5.
Yeah.
And it gives me the metaphors. And I'm like, oh, okay, now I can add the big words and I can start understanding it much better. But I feel like there's just so much of miscommunication just because when we talk with people in their industries, and you see this in the way, you can even see it on social media when PTs are like explaining exercises. I'm like, you have to use metaphors, like you're saying. We have to teach them about their bodies so they can understand it or feel it in their bodies. One of my favorite things to do is kind of show patients, like, okay, well, why is standing upright helpful? And then I will have them just go ahead and bring their ribs over well, before they do anything, I push on their shoulders and I push down. I'm like, what do you feel with that? Do you feel strong? And they're like, no, it feels like a give. And then I have them stack their ribs over their pelvis and get a little bit more thoracic extension because most people are kind of rounded like this. And I push down and they're like, oh my gosh, wow, like,
Rounded, not kyphotic.
yeah,
Because
yeah.
like, what's that mean?
Yeah, exactly.
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 Yep, rounded.
So they're more up, and then they could feel that in their body. Then they're like, "Oh, that makes sense." And I say, just notice it. Sometimes you don't even have to do anything. I just want you to start noticing what your body's doing. So yeah, just getting them to notice it, because that's the buy-in right there, and because I sat and started thinking, I'm like, what about, because when I first started as a PT, I couldn't keep clients. I didn't know how. Wasn't taught on how to speak to people. And so I was also in like a very uncomfortable situation with my first job, and I was a new grad and I was asked to treat like 4 people at the same time that I had never met.
Wow.
And I had to quit that job pretty rapidly because I did not feel comfortable. So then that kind of traumatized me for the next job. So I really had to dive into this and be like, how do I do this? How do I learn? And honestly, I don't remember exactly when or what. I just knew. I told myself, I said, I'm going to be a good public speaker, even though I hated public speaking. And I'm going to have such good rapport with people that I meet, and I'm going to be able to talk to everybody. But I don't know how to do that yet.
Yeah.
But I am going to do it. And it's just funny because that, just knowing that in your brain and saying that to yourself, and it changes everything.
And that's like what's interesting, because you go to school, like PT school, to learn like how to do these things. You don't learn how to school. Most colleges, they don't teach how to be good teachers, and to be a great leader or a great X, whatever profession it is. You have to be a great leader and you have to have great communication skills. But what I learned in school, or actually I learned from started doing my coaching training. It was an international coaching school. I was 24 years old and I was surrounded by, there was like 16 students. It was a 14-month program. It was like the neurolinguistic psychology, beginner, advanced. There was hypnotherapy, beginner, advanced, and certain like coaching principles. It was a whole like therapy to coaching program. And half the students, 8 students, had their PhD or masters or PhDs in psychology. And I'm like, I haven't even had taken maybe like a semester in psychology at the time. I was actually going through it at the same time. And I asked them, like, why are you, like, with all due respect, like, why are you guys here? You have these degrees of things on the wall. They said, Jeremiah, they don't teach you how to get to the root cause of the client and actually what to do when you get there. They teach us Freudian theory, Jungian theory, all this stuff. And they basically said, you'll find your way. But they don't actually teach that. And then so I was like, they said I was at an advantage. I'm like, okay, I trust you. And now looking back, I was. But I went through this training and I found out that they don't teach how to learn in school.
Oh, yeah.
School doesn't teach how to learn. They say do this and repeat. But actually, like what I've learned in my training, there's actually like 5 different levels of learning. There's like, it's called unconscious incompetence. Like you don't know what you don't know, which means you don't have a file for it in your mind. I can say, like, to the average person, transverse abdominis, what? Like scalenes, what? They don't know what that is because it's not anchored. They haven't learned it. So everybody goes through this learning. You don't know what you don't know. The second level is conscious incompetence. Now you're aware that you didn't know this. So that's like, it's still ignorant. Like it's ignorance. Now you have awareness, but you're not good at it. You have 0 repetitions. So whether it's speaking or you fill in the blank, PT, anything, communication, then there's things called conscious competence, which is practice. That's X amount of repetitions. If you do it X, whatever the skill is, X amount of times, it will become automatic. We don't know what that is. It could be tying your shoes. It could be doing brain surgery. There's X amount of repetitions where it just becomes a habit, a pattern. Unconscious competence, you can just do it without thinking. Then there's conscious, unconscious competence. Basically, you can teach it to other people. So that's not taught in school. And then also, people are more visual, auditory, or kinesthetic dominant learners. And the majority of women on the planet, not all, majority of women, well, more than 50% of women on the planet are visual dominant learners. The majority of men, not all, but more than 50% of men are kinesthetic dominant learners. Visual dominant learners like to see things with their eyes or get a picture in their mind before they understand. Visual dominant learners, they're quicker learners. Not necessarily deeper. They could be quick to understand or quick to judge. That could be like a positive or negative. Kinesthetic dominant learners is we have to actually, I'm a more kinesthetic dominant learner, so I have to actually experience it. I have to actually get a feel for it, which most PTs are, and most like personal trainers, massage therapists, most people that do the body work, they're more kinesthetic dominant learners. The issue that they don't teach in school is that, and this just happens all the time, is whatever your dominant learning track is, naturally that's what you're going to give to other people. So if you're visual, you're going to say things, visual predicates. You're going to like show people. And this goes to relationship. Love language is like love. It's like, I'm showing you I love you. It's like, but I don't feel it.
I love that.
And they miss the mark, whether it's a love language or communication track. So school doesn't teach how to be great learners, whether it's college and this and that, or how to learn. So when PTs, like we actually teach people how to do that and actually how to do it for themselves and then for their clients, is you got to understand what's your dominant learning track too, but then who you're talking to, and you have to deliver it in a way that works for them. If you don't, it might not go. It's where you hear like a lot of men and women relationships have issues because the majority of women are visual dominant learners. Like, I'm not seeing you love me. And it's like, what do you mean I'm doing all these things for you?
Yeah, they do. They do a lot of like the primal things. Like, look, I did stuff around the house. Like, I fixed the fence. It's like, and then the woman's like, but I want it to be touched or talked to or attention, and like it's
And
like
both of them
they're
are
speaking.
underdeveloped.
Yeah, and they're in love, but they don't know how to
Not on
how
the
to
same page.
speak, and it's so.
So it all comes down to relationships. It all
Yeah.
comes down to communication. It all comes down to understanding the mind, how people, like how you learn, how they learn, how people work. Then it's so easy.
Yeah.
And then that's the basis of doing the deeper healing and the deeper things that other people can't figure out, or 1,000 PTs work with this one person and it doesn't work. And you could be the difference maker by actually getting to the root of it. Because the majority of we talked about this before, 80% of physical issues or dis-ease is not physically rooted, it's physically manifesting. Either comes from the psychological, which is deeper than the physical, or the spiritual or emotional, which is deeper than the psychological.
Yeah, yeah. I mean, it's interesting because in our clinic, I've noticed themes. Like we'll get referrals from people and be like, sometimes we're like their third, fourth PT. And, and I don't like it from an ego perspective, it's like, oh, okay, but it's not about the ego for me. It's about what is going on.
Yeah.
Again, how am I different? I'm not doing rocket science. Like I'm literally just doing I'm like looking at it from like all angles. I'm looking at this person as a human being with like a mind, body, and soul. I'm talking to this person and letting them be a part of the conversation. So evidence-based medicine is the patient, the practitioner's experience and research. And we're missing that. I mean, we're not practicing evidence-based if we're not including the patient in it or the client. And then also, I didn't fall into like the stereotypical like be so professional type thing. I feel like like that almost put like a guard
Wall,
up, a
yeah.
wall up where you can't be a certain way. You can't be yourself because that's unprofessional. And I've always been silly and playful. And so I mean, obviously it depends. And I try to meet the patient where they're at, like, and I meet their tone kind of naturally. Like if they come in and they're like talking like this, and I come in and I'm like, hey, like da
Yeah.
da da da, and they're
They're
like
gonna
still
go,
like this, or like
yeah.
they don't know why. They probably don't know why, but I know that I've lost that rapport right there. And so, I learned earlier in my career some of these skills
Mm-hmm.
that were never taught. And then became fascinated with them and just started studying them and just becoming obsessed. And I realized like so much of what we do in our clinic is we're meeting the patient where they're at, the client where they're at. We're talking to them. They're a part of the conversation and we're teaching them about their bodies and then focusing on empowering. And if somebody's not getting better, the typical way, like the PT world or like any healthcare practitioner in general, it tends to be like, if we don't do this work, then our egos hit. And then it's like, if I'm not a good physical therapist, then I'm not a good person. I think there's like a direct
Identity.
identity
Mm-hmm.
issue. And I'm like, no, 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 no. You cannot get somebody better and still be a good PT because it
Mm-hmm.
also depends on, first of all, maybe it's your communication. Maybe that patient's not ready to actually
Let go.
let go and get better. Maybe they just want to be told what to do. And the people that want to be told what to do from a patient standpoint, they don't get better because they don't want to learn. They just want to be told. They might get better for a little bit, but it's until they want to take the time to go in and deeper. So that has nothing to do with the clinician's experience. I can be the best physical therapist in the world, but if somebody doesn't want to listen and their heart's blocked off and their brain's blocked off, I can't help them.
And it goes back to the three things I said. There's positive, negative, and no attention. Sometimes let's not talk about the people who get better. Let's talk about the people who don't get better. The majority of time, if the PT, doesn't matter if it's chiropractor, PT, doctor, you name the profession, if they can't, you ever seen like Indiana Jones where I think it was like some sort of skull. It was like
Yeah.
whatever that skull, and he took like the bag of whatever coins or rocks, and he had to switch it really quick so the thing doesn't, it didn't like blow up or whatever. It was like at a timer. He had to like
Oh, because
grab
if he
something.
lifted up the skull, it would do an alarm.
Yeah, and you had
Okay.
to keep the weight.
Yeah, yeah, yeah.
Well, it's kind of like that. It's like if you're coming to me, if I'm the PT and you have some sort of issue, and you kind of put your hands out like this for a second. So you're
Yeah.
you're coming with your pain, right?
Yeah.
But it's like, hey, I'm gonna take your pain away, and you go like this because you're actually unconsciously not gonna do that because your pain is giving you attention, even if it's negative attention, even if we're here and you're in pain, I'm touching you still. I'm actually caring for you. Now, if you get rid of that, where else are you going to get that in your life? So the issue with the PTs or the people is that you have to, the technique, it's called a 6-step reframe that we teach to our students or professionals, but basically there's a higher positive intention behind every behavior a human has, everything. So like, for example, like injury, some people get injured over and over and over again. Like why do people get in car accidents over and over and over again? Why do people get in bad relationships over and over? Why do people repeat these things and other people don't? Well, somewhere wired within their brain or their mind is like they actually get attention from it. It's negative attention, and they'll fight with like a death grip. Like, I'm not going to let go of this unless I have alternative ways to get actually positive attention. So if the PT doesn't know how to do that, which they don't teach that, and so you have to go outside of your scope to be able to do this, you actually can talk to the person and find out like what is the deeper meaning, what's the higher positive intention behind this pain. Pain is the body's check engine light. Like in a car has check engine light. It means pay attention. To the degree we as human beings do not pay attention, we will pay with pain.
Oh yeah. Oh yeah.
And so,
Not wisdom.
but it's exactly, but it's not just like if your knee is having an issue, it's like there's no amount of massage and this what that will help necessarily. So it's like, okay, cool, I can put my hand on your knee, but like, what's the emotion that's coming up behind it? Where is that coming from? How long have you had this in your life? So the emotion that's not getting dealt with manifests in the pain.
Yeah.
And it goes even beyond that. This isn't woo-woo or whatever. Anybody has knee issues, they're being slowed down, but they're generally running away from something. If they have like hand issues, they're holding on too tight, or they're not holding on something enough. If they have back issues, it's something from their past. And so like it's not just a spiritual concept, psychological concept. This is true, but then we have to do the research to be able to find it. But people won't let go. People that aren't getting better, it's because they're not letting go of the attention that they're getting. So a technique that we do is we actually find what is the higher positive intention behind the behavior. What are other behaviors that they can do to get the same need? And then once they do that, like Indiana, they'll let it go. That's when pain can happen very quickly. Or I mean, healing can happen very, very quickly.
But I do believe, that pain and emotion are highly correlated, right? So if somebody's coming in and like for me, I had chronic neck pain for years and years and years and kept doing all the latest and greatest PT stuff. And it wasn't until I started speaking my truth because I was holding back and not having boundaries and just, giving away my energy. And once I started noticing that, I stopped, and it wouldn't help the active flare-ups. So I think this is something that there's a lot of, I think, confusion around with. I've had patients that were told like, oh, just release this emotion, but then they're not taught how to do
Yeah,
it.
how? That's
So
what.
so then they feel gaslit, but they're still in physical pain. So I like to just say like, hey, we're still treating. We're mind, body, soul. So you treat the emotion and the soul, but there's the physical body too. Because I know if I'm in an active flare, I know what it's from, and I know I need to work on it. But we still work on the physical body. But I think PTs still work on the physical body, but we need to start understanding, hey, what is like this whole other aspect, right? That we need to be paying attention to. But I think kind of what you're saying is sometimes people don't have the skill set to know how to release that. It's a different conscious level. And that's a whole other skill set. And so if the practitioner doesn't have that skill set, but they're saying that, then you're almost like shitting on them and then being like, why do you smell like shit?
It's telling homeless people, get a job.
Yeah. Yeah.
Like yelling at homeless people you drive by, why don't you get a job? Why don't you
Yeah.
contribute to society? Clearly something's going on.
Yeah.
They're showing it's the same thing. It's like, that's what I'm saying, differentiating the what and the how.
Yeah.
Like in my whole life, we talked
Yeah.
about not being told not being like told what to do or whatever. My whole life, if somebody asks me something or give me feedback, like cool beans. How do I do that? I don't
Yeah.
know. What would be the purpose of telling me to do this thing if you don't know how to do this? What value is that? They're like, oh,
Yeah.
I don't know. Well, maybe you should.
Maybe
Yeah.
you need to understand this yourself
Yeah.
first before you teach it to others. Kind of what you're saying. Like teaching is a whole other level of understanding something. I mean, you can know it, but then to put it in words and to articulate it to other people, you have to know it. And so that's a big thing I've seen happen in the medical world is people are gaslit. They call it gaslighting because they're just like, well, I'm told it's in my head, but I still have physical symptoms, right? There's still physical ailments that, like certain things that people experience. Like we know this with certain diseases or impairments like endometriosis. Like we're just now barely scratching the surface and understanding it. And it's a predominantly in women or people that have uterus or vaginas. And you don't even have to have a uterus too. Now we're learning. And so, but there's these things that people are almost predisposed to and are the way we think and the way we talk and our emotions can almost like crack that open, like epigenetics basically, right? So like you have this genetic factor, but the environment, how we speak to ourselves, our emotions, our spiritual self, like if all of that if we're just in constant dysregulation from a physiological standpoint, we don't have homeostasis in our body. And we don't have homeostasis, then, okay, we're going to crack open those maybe genetic factors that wouldn't have been cracked open before if we weren't looking at our environments.
And you said something really interesting earlier about flare-ups and like where a PT might not be able to have an answer. Like if the client says, why do I have this flare-up? And they might be like, I don't know. It's just like, let's treat it right now. That's where I can tell you exactly why you have a flare up. The physical flare, literally pain is a flare gun. But the question isn't like when most people, how the mind works and really more the ego wants to move away from pain towards pleasure. So when people are in pain, I need a medication, like I need you to come to get me out of pain. That's the opposite of what I do. So we actually go into the pain. And it's miraculously, mysteriously, coincidentally, when you actually go into it, it actually goes down because pain is only a flare gun. It's a flare. That's all it is. A flare up is, but the more important question, who's sending it? It's not the physical body. It's coming out. It's not starting it. Unless you stub your toe or hit it, then that's the only kind of thing. Whether that's not the pain we're talking about. But who is sending the flare? And I can always tell. It's like, okay, for chronic pain like this, or pain that's been for an extended period of time, there's emotions anchored to it, or
Oh yeah.
emotions.
Yeah.
So we're getting closer to it, but there's also beyond that, there's a location of the emotion. So there's something that happened in the patient or client's past. They didn't have the ability to fully experience something. So then they psychologically and spiritually separated from themselves. And the body that you're working with, whatever age, day, and time, that's not where the problem's coming from. Like the person is coming and they're resourceful and they're helping out. But it's actually coming from this part. That's what's sending the flare.
Hmm.
And those flares can actually permanently go away if you permanently meet the needs of this part, release what doesn't need to have, learn this deeper spiritual lesson, bring it to the present moment, integrate it, grow it up, instantly, miraculously, coincidentally, no more flares the rest of the life. That's permanently connected. I say that and no more flares, but if that actually works, sometimes other parts will use the same doorbell, the same flare. It's like, if that worked for that, help me out too, because we have multiple parts. We have so many parts of ourselves that we psychologically, spiritually separate from ourselves. Anytime you don't have the ability to process it, so no, not one human being is ever born with an ego. And people don't talk like this and think about this, but if I say it, it'll make sense. Nobody's born with an ego. What babies do, and really like 1-year-olds, really young children, if they hit their head, fall down, go boom, if they are too hot, too cold, and too wet, they need to get held, they cry. And what happens is the body's nervous system fully experiences and fully processes it. So there's no carryover. We see it in children, they fall and they hit their head, and then, you okay? I love you. You're good. Okay. And then they go and
Yeah.
here's a
Like
snack,
nothing happened. Yeah.
but they experience it.
Yeah.
Where do adults go cry like that? No, they hold things in and passive aggressive and all that. So at certain points, so the ego enters everybody generally around the age of 2. So that's why they call it the terrible twos. It could go a little bit sooner, a little bit later, but the ego starts around 2. Nobody's born with an ego, actually. And then once there's an ego, the person now has the ability to resist or reject. There's instead of hurt happening, now it's I'm hurt or you hurt me. And then if the child doesn't have the ability to fully experience it, which children don't, but if there's the ego now, they can resist. But if their environment, their parents are like, suck it up, big girls don't cry, or whatever they say, or just like you're fine, and they don't like what a parent actually is supposed to do. Parent can only do this if they can do it within themselves. If a child's having an issue, the parent's supposed to get down on their level, like on their knees or whatever. Let's say it's a 2-year-old. Put one hand on the front, on the heart center, put between the rhomboids, between the shoulder blades, put one hand on the back of the heart center. Relax and breathe with them. Like if they're breathing, breathe a little bit more and say, you're okay. We're going to fully experience this and process this together. The issue is the parent has to feel what the child's feeling too. If the parent didn't do this for themselves when they were younger, because their parents didn't do it for them, they don't know how. But you can go outside your ancestral lineage and learn it from someone like myself. Like the whole apple isn't far from the tree. Go to a banana orchard. Go to a peach orchard. Your family's not going to have all your answers. Your school's not going to have all your answers. Your life experience is not going to have all your answers. We need each other. So that's what a parent's supposed to do, is to help them fully experience that. Once they do, there's no carryover, there's no part. They learn the lesson, they become resourceful that I can hold space for myself. I can actually feel it to heal it. But we don't do that. So anytime any human being doesn't fully experience, there's a separation. The longer it gets, it's going to come up and communicate. It seems like trigger, or the word you use was where it just kind of comes up, you said, like,
Like a flare.
yeah, triggers or it flares up. You
Yeah.
get flare-ups or it gets triggered or out of nowhere, people regress. Most people, they think that they are the age that they are, but then why do they act like 4-year-olds or 17-year-olds?
Oh, like
Because,
Gabor says this a lot, where
yeah,
like, people. He's like, if you see somebody throwing a fit in as an adult, you're seeing a child throwing a
hmm
fit. You're not actually seeing the adult. It's the
hmm
child inside them that's
yeah.
throwing the fit, and they need to work to heal that.
Which,
And
how are they going to do that?
yeah,
Where are they going to go? That's
exactly.
what we do,
Yeah.
but it's not common.
But I mean, if they don't know that, like, that's not common knowledge. I mean, there's somatic experiencing too, where people
hmm
can learn how to. That's Peter Levine's work of like moving through the
hmm
emotion. And sometimes they don't even use words or anything. It's just getting the body to feel it. But then,
Which may or may not work, and EMDR may or may not work, and
mhm,
some of the things may or may not work unless you actually the part actually is stuck
mm,
psychologically. Like if there was a problem coming up for you that you were having, and we were to do this like right now, and I actually ask you questions and find out where in space and time it's from, it's the part still needs to come to 2025 in this present moment, get resources because you've learned some things between what happened and where you are now. You've learned a lot, but there's no communication. This part's separated from you, separated from the divine, from all the resources you've learned. So if you actually could if we isolate this problem, this part that's having a problem, what it needs, what it's lacking, if you can actually give it to it or ask your higher consciousness to give it to it, instantly it gets freed. But that's like half the equation. You need to also like give it a hug.
yeah.
And then healing happens because the only reason it's so interesting because like whatever pain or emotions that were happening at the time, that's what gets triggered.
Well, I also like when I get triggered, wanted to dive in a little bit too. I've been to like trauma healing conferences or events or retreats. And what I found really fascinating there is there's two types of people, generally speaking. There's the people that actually want to heal, and there's the people that just want to talk about their stories over and
Yep.
over and over.
Because they get negative attention.
Yeah, and that was something where it wasn't regulated, so they were dominating the retreat, and it ruined it was maybe not ruined, but it really negatively affected the people that were there to truly heal
hmm
because they just wanted to be heard. And so there was no regulation on that. And that is something where if I in the future when I do retreats and stuff, it's like, no, we are nipping that in the bud real fast.
Yep.
And people identify with it. And the people that identify with it, like, yeah, we all have some form of trauma. Some people have. And trauma is more of your perception of what happened because two people can experience the same thing and one person can be traumatized and one cannot be.
Correct.
And so for like me, I know that I remember the first time I was told, oh, you have complex PTSD. I was like, oh, how do I work on this? And there wasn't really an answer. It was just
Yeah.
like, I'm just going to be traumatized for life. So like, are we all just sitting out here waiting? Because everyone's going to be traumatized at some point. So
Mhm.
then are we just kind of screwed the second it happens? Because that's what I really thought. I was like,
Yep.
wow. So am I just unlucky now? And I was like, I'm not going to be a victim to this. This is not, I'm going to learn from this. And it was, as I've learned from it, I don't say I have it. I say I'm working through it or I
Yeah.
have worked through it. Because if I identify myself and say I have trauma, well, we all have trauma. And we all have had childhoods maybe that weren't ideal. Some were probably horrible, more horrible than others, but so much of it is that we're not special in our traumas. These are things that we experienced, and we can do one of two things. We can sit in them and we can identify with them, or we can grow from them. And I've always choose the growth aspect. I sit and marinate a little bit. Yeah, I mean, don't get me wrong. There have been plenty
Yeah.
of times where I went through my healing journey of, cancer, divorce, COVID hitting, and my ex-father-in-law was like a father to me all within 1 year, like losing him to cancer. I was like, I was so stripped from my identity. I had no idea who I
Yeah.
was, and so didn't have any of these skills. I've never felt so vulnerable in my life.
Which
But
is the textbook awakening
I
process.
needed it.
Yeah.
I mean, and it was funny because it was all happened during COVID, so I couldn't go anywhere. I initially wanted to be like, I just want to go out and date and travel and just like forget about everything. But the universe or God,
The mirror in front of you.
it was like, oh, hell no, you sit back down.
Yeah.
And I didn't realize what such a gift that was. But
Mhm.
I think that we're going through this collective shift right now in society or in the world, and we're seeing it, but you see people don't have these tools. So that's why you see the people that are really struggling don't realize that there's this whole other aspect of how to look at things and how to communicate and how to understand.
because they're not ready.
Because they're
Because
not
that,
ready, but also I think some people are, they just don't know the resources. And then, yeah, there's plenty of people that aren't ready.
but that's been my life. So I don't know if you've seen this video. There's a really cool video on YouTube over the years, but I think it was a white gym teacher, and there was all like kinds of kids, like different like races, minorities, and white kids. And then he said, "Okay, I'm gonna give you like $100 or $200 for any kid who like crosses this line at the 50-yard line. Everyone's gonna stand at the goal line, and take one giant step forward if your parents
Oh,
are still." If they're still together, take one if you've never been on welfare, and this, and it's a really good video, and they
I
show
love
that.
that video.
But the way I'm a minority, and there's
Yeah.
no excuse. I grew up in the ghetto. I was one of those kids on the goal line.
Yeah.
But in the world of success, there's only solutions, not excuses. Of people that will learn the deeper spiritual
Yeah.
lesson from this and profit,
Yeah.
or people that will do this and they'll make other people miserable.
And I feel like I liked that video that you were saying. I know you might have had a different opinion on it about raising up the flag and being like showing somebody like the level playing field,
Mhm.
right? And like the kids that had their cell phones paid for, that never had to worry about money, never worried about food. Yeah, they ran to the end and then they looked back, and maybe it was a
Yeah.
realization for them. But I guess the point is, yeah, the playing field might not be level, but that's still not an excuse, right? Like,
Never.
but also I recognize I have privileges in my life and I have things that were not privileges. And so we all have something where,
But being in America is a privilege over
yeah, exactly.
97% of the world. Like,
Totally.
that's
But being a woman, even though I'm white, I'm oppressed because I'm a woman, right? And it's like, okay, but if I constantly go through those goggles of I'm an oppressed woman, yeah, I'm still gonna fight for my rights. Hell yeah. But if I just go all the time and be like, yeah, well, I just, I'm a female-owned business, so like nobody, people don't support me because I'm female-owned. Okay, well then I'm gonna keep attracting that. But instead,
Yes.
I'm gonna say, oh yeah, that this sucks. That's a downside,
Yeah.
But I know white men get shit on all the time, and I'm like, well, like there's stuff that comes with being a white man in the U.S. that's considered privileged. It's like there's other stuff that goes with that too. So nobody is free of this. Like, we're in this human experience, and we have to figure out how to get out of our unconscious brain to get
Mhm.
to our highest self. And yes, we can recognize and understand, yeah, these are negatives, but where are the positives that we
Yeah.
have?
And it's like only two choices. Do you focus on what you want or what you don't want?
Mhm.
Because whatever you focus on, you only get more of, period.
Exactly.
So it's like the whole victim or the poverty. It's like, so I grew up in poverty. Cool. What's my solution? Like, I had these limitations, ADD and deathly ill multiple times and all that stuff. But it's just like, so what do I do with this? Like,
Mhm.
I just always had that in me. It's like, I'd rather die before I fail. Like, if I don't have a watch, but I check my whoop strap, but like, oh, there's still time on the clock. I'm still alive. So there's still, different things. And it's just that whole victim mentality I just moved away from. If people want to do that, they can, like, we're in a free country. Go ahead and be a victim. I'm going to go over here and look for
It's a
success.
choice, yeah.
And I did. And I'm just really grateful. I did to be able to help people. But that's the whole thing is like, you talked about those four really big things that happen in a year. In the spiritual world, there's a saying that suffering is the greatest catalyst for awakening. So when I say those people aren't ready, I usually say they're either not ready or they haven't suffered enough. It hasn't
Yeah, it's
gotten
like a
bad enough.
boiling, like they need to be like,
Has to get
because
worse.
it's very, very few people that I've encountered. I'm still early in my spiritual journey, but because it's been about a year of me really waking up to all this, because there's a lot of stuff shifting once you really, I mean, the start of it was 5 years ago, but or almost 6 years ago, but like really diving in, the last year is just that there's just this piece of it where it doesn't come from wisdom. Like, I mean, there are certain people I think that are old souls and they've been here many times and maybe they naturally know things a bit more. But for the majority of us, we have to experience some extreme amount of pain, like a pressure, like making a diamond, right? It
Mm-hmm.
takes an extreme amount of pressure to make a diamond, but everybody wants the diamond, but they don't want the pressure.
Yeah.
And you see this in business too. Everybody wants, to make millions and millions, right? That's why everyone's trying to get famous on TikTok. And it's like, okay, but you have to still do the work to get to that point. But people don't want to do the work. But then they want to complain about not having the results. And I physiologically cannot have those types of people in my inner
Yeah.
circle in any capacity.
Same.
Anybody that works for me, anybody that I'm friends with, anybody that I associate with, I can't. And
Boundaries.
and that was so much of me weeding out like that the last 6 years, and it was painful and a lot of grief.
Yeah, but what's it like now?
Oh, it's wonderful.
Freedom.
Freedom.
Mhm.
It's freedom, but it's like this.
It's a divisive
Yeah.
energy that wants to keep people victim, focusing on negative, focus on what they don't want. And it's basically, it says, we don't want you to be free, but we don't want you to leave, what we're doing. That's what the energy says. And it takes a really strong person to break through that. And it will say, like, no one's going to love you. You're going to be alone, this. And you're like, well, I'm going to have my own back. Like, still going to do the journey. And then you get away from it and see, then it's just like, you can breathe. It's like, the issue was this energy. The issue wasn't whatever it was saying it was going to be. And so actually, that's just a personal journey that everyone needs to take, and nobody can force. You can't force growth, can't force transformation. Person has to be ready. And it's not even a bad thing. It's just suffering needs to, like, okay,
Yeah.
the universe says, let's keep going up higher until you submit, like old school wrestling, tap out.
Yeah,
It's like,
I'm out. I get it.
I
Stop,
submit,
stop,
now I
stop.
want
Yeah.
help. Because
Yeah.
not even the divine can help people if their ego is resisting. Not even God, the divine presence, can even help them. They can't, because we have that free will.
Totally.
We have the ability to reject the divine presence, our source, what we're created from. And when people do that, like, suffering only happens far away from the divine, period. So then once people, like, finally submit, which I did, and it's just, you did, it's just what happens. And then there's levels and processes. But then that's when the divine presence instantly comes in.
It's like, it's crazy when you can accept it. And it to me, it's not even a religion. It's more of just a higher sense of something greater than us that truly loves us. And there's meant for more. And we're meant to be here to break through all these barriers, to tap into our highest self. And it's like, but people aren't ready to hear it. And so it's just.
Some people.
Yeah, sorry.
Yeah.
Some people aren't ready to hear it. And I'm not here to convince those people. And I'm a PT coming out talking like this. This is not common for PTs to be open and practicing and talking this way. And I am willing to be the trailblazer with this to help pave the way so it's easier for other PTs to be able to, because they're seeking. I see it. And I see a lot of women that are like in their 40s, approaching perimenopause. And the coping mechanisms that they used before perimenopause, they're not working anymore.
What kind of things?
Like, sometimes it will just be like over-exercising or drinking or chugging coffee or just kind of numbing out, binge watching things or whatever. Like, those things, like, maybe they helped like a little bit back then, or they thought it was helping. But
40s are different.
Yeah, but 40s are different because your hormones start shifting. Like, I just found out I'm in perimenopause, and I'm like, oh, I can't rely on caffeine. I can't even drink at all. And it's interesting because now then you're exposed to, well, I have to actually look at my shit now. And when you have to look at your shit and you don't have those things, it's really tough. And I've seen it in a lot of like heterosexual couples where then the partner, like the man, is like still doing the old stuff, and the woman's like, I'm not doing this anymore. So you see that I've been seeing a big divide around like the 40s or 50s where women are like, I can't do this. And then there's this chronic kind of dissociation from the male side. And I think that's a systemic thing that we've taught men too, like from a cultural standpoint, like, hey, don't have emotions. Be a man, And so then we're blaming them for not being able to open. And so you've got so much of this disconnect. And I don't believe men are inherently bad. I don't think women are. I don't think anybody is inherently evil. I think that we're constantly just trying to communicate. And if we don't have these communication skills, and so now if you're a practitioner and you're having trouble at home, how can we show up with clients? And so we start running into these deeper rooted things of, okay, well, we have to learn about ourselves first.
Yeah.
And that's what I keep saying. And so
that's why a lot of therapy doesn't work, because a therapist, a coach, or wherever you fill in the blank. Even you said like, I'm not doing things. Why am I so different? Because you care, because you had like with your brother, whatever experiences you've had in life, like you reach deep and within to be able to help. It's part of your purpose. That's not for majority of people in business. That's not what it's like. But let's just say a therapist, or any counselor or therapist can only help somebody, their patient, to the level of depth they go on within
Yeah.
themselves and transformed. And it doesn't work if I want to help people and go to school and I don't want to do any work on myself, but I'm going to help other
Well,
people.
that's their trauma response.
Yeah.
That's their trauma response is, well, I don't want anyone to feel the way I'm feeling, so I'm going to go be a
Yep.
psychotherapist, or I'm going to go be a PT. But now we're not healing why we became a PT in the first place, because I would dissociate. I'd be like, well, I'm going to take care of everybody else
Mm-hmm.
because that's my identity now.
Mm-hmm.
And then I got sick.
Spot on.
And so we all have our I believe a lot of us, we have our professions. If we haven't done this work before, which most people haven't, choose them based on some type of like compensation.
And that's an interesting point because there's a difference between masculine and feminine energy. A lot of people in the collective conscious think that masculine equals male and feminine equals female.
Oh,
Every
yeah, it's
human being
not.
has both.
Yeah.
The head is masculine for everybody. The heart is feminine. The left brain is masculine. The right brain's feminine. Like our skin is more the masculine. Inside the organs is feminine. So most like even like women that do that, like women who don't get an environment of like balance become more disconnected masculine. Because if no one's gonna do it for me, I gotta do it myself. I
Yeah,
can't rely on
you see that a
people.
lot. Yeah.
Mhm.
So what would you say? Because there's a lot of women dealing with this right now, and they are in healing spaces as well, and they're struggling in their relationships. So how can they, like, what could be like one thing that helps them just, you know, what would you say to help them if they're in that boat?
If they're like, what? Well, if I was talking to somebody, it'd be more personal and technical. But if somebody's watching this, I would say the first step is awareness. You have to be aware that yes, you are a woman, but you're acting more not manly, disconnected masculine. Because there's connected masculine, disconnected masculine. There's connected feminine, disconnected feminine. So connected masculine is like providing, and men and women can provide, but it's providing, it's protecting, it's doing. But there's overdoing, which is disconnected masculine. There's like lashing out and things like that. But feminine, so connected feminine is like the feeling, the nurturing. Disconnected feminine is like too emotional, like crying from everything and like narcissist, like you did this to me. Like, have you ever seen The Sopranos?
I haven't,
Tony
but I know
Soprano's
narcissists.
Tony Soprano's mom was like, "Oh, Tony, you did this. You're the worst." And so
Tony.
yeah. But the no, first thing is awareness. So
Yeah.
they have to be aware, like if like a woman watching. So if that you are a woman and you're operating, behaving from disconnected masculine energy, where is that coming from? There's an imbalance, and you haven't got your needs met. Where's that coming from? It's not even psychological. It's just true. It comes from your parents. Either your dad was too disconnected or your mom was disconnected. Like people think like, oh, it's a dad thing. So psychology might be
Everybody
things from your
blames
parents,
dudes now. Like, it's always the dude's fault.
which is disconnected masculine energy.
There's so many wonderful men in this world.
Shitting on anybody is toxic masculinity.
I
That's what I'm
see.
saying. So people think
That's not
toxic masculinity.
feminism. That's just toxic. Yeah.
No, it's
Yeah.
disconnect. It's
I think people are confusing the two.
yeah, because people think feminine equals woman. It doesn't.
Mm-mm.
We all have the energy. It's like sun and the moon. Do we all have aspect to the sun and the moon? The sun is masculine, the moon is feminine. Do we all have aspect to it? Yes. It's not like women can only see the moon and men can only see the sun. Men can only go out during the day. That's what people are saying. Men can only go out in the day. Women can only go out at night. Well, that makes no sense.
Yeah.
So it's the same thing as men are masculine. So there's a lot of like weaker men on the planet too.
Oh, yeah.
That's disconnected masculine energy.
Yeah. Well, it's also then what's happening with the dude that's disconnected, because what you're seeing is just kind of this epidemic of disconnected men holding in their emotions, being angry, disconnecting from their families, and then overworking. So you see that. That's just like the very standard thing. I mean, not every man, and just
Correct.
clarifying.
Yeah.
But when we're looking at common themes that I see in my practice, in my social circles, in my friends, in my family, like all these different things, these are common themes that I see. And so how would you explain the disconnect like that?
It's kind of the same thing. So in collective consciousness, mostly through religion, people teach that God is a he.
Mm.
And at best, like if like I have no problem if the whole planet said like God is a he, no problem. But I would say at best, you're only getting 50%. So then some people say, no, God's a she, God's a woman, the goddess, and all this cool beings, you're only getting 50% of the best. The God, the divine presence, it's like two sides of the same coin. There's the divine masculine and the divine feminine, called the divine parents. But a lot of religion, like even in like Christianity
It's
or
all he.
Catholicism, well, the Father, Son, the Holy Ghost.
Yeah.
Where the real Trinity actually is the divine Father. It's an upside down pyramid. The divine Father, the divine Mother, and the child.
Yeah.
That means you. That's
Mm.
insert everybody. That's the relationship. So a lot of people, the way you relate to your parents, consciously or unconscious, the way you relate to the divine. So if people don't have a great relationship with their parents, they don't have a great relationship with God. People that have issues, abusive father, then I like the mother side. There's nothing wrong with it. But you can actually ask the divine mother to help heal your relationship with your father, which actually to do that. But that's the thing, is people are watching. It's the same thing, but inverse, where like, and the other thing too is a lot of times like with religion or spirituality, like we'll use cars for example. Could human beings like fully agree upon one car to use?
No.
Could we, every single microphone, would that work for everything? Would every single size of clothes? So I can keep going on. No two snowflakes have ever been the same. No two thumbprints, no two leaves have ever been the same. No two molecules and atoms. How is it that the whole species could relate to God one way? Impossible. It won't work. Anything like like if I say like the whole species, like this is God, everyone has to believe this way, it wouldn't work for anybody else. There is only the one presence. It's not one as singular as separate. It's one as all that is. But the only way it actually works for people is if people have a personal relationship, meaning like the way you relate to it's the same presence, but you relate to it in a way that it won't work for anybody else. Almost like a key. It's like your key to your house works and it doesn't work in any other house. That's the same thing. So people need to heal their relationship with the divine, because a lot of people that like atheists, the only reason why atheists exist is because they've been hurt before and they blame God. That's what an atheist is.
Oh yeah. I mean, I
That's
was
it.
an atheist for a long time. Because I was pushed to Catholicism, and in my nobody that I had met could explain why we did the things that we did, and
Mhm.
they would react negatively.
Yep.
And I
Which is
took that,
divisive energy.
yeah, and I was like, if somebody would have sat and taught me, maybe I would have stayed that way. But nobody taught me. Nobody could explain it.
Mhm.
Nobody could sit down and be like, this is what we believe, and this is why. It was met with anger
Yeah.
and resentment and lashing out and
Divisive
punishment.
energy in religion, which is the opposite of God and the divine.
Which is so funny because you
Yeah.
see this like everywhere, and not everywhere, but like in a lot of places.
It's not in every church or whatever, but it is in churches. It is in religion. Not
It's
everyone. It's in schools. It's in offices.
Yeah,
It's in
and you can't ask these questions. You can't ask and understand these things and understand why without the reactivity.
Yeah.
I didn't know any of this stuff existed, but if I'm going into um like the community that I'm at and I'm asking the leaders in the community and they can't tell me, I'm not going to respond to that. Like
Yeah. Correct. Oh yeah.
yeah, I'm like,
You
okay,
go to a
so
different circle, a better
yeah, go to
circle.
a different circle, and then just seeing how people handled it. But I guess my point is more of what you were saying about when people aren't getting along with their family, and then that relationship with their parents. I do think though that it's funny because I've had a tough relationship with my family for a long time. I resented them for pushing religion on me, and as I've healed a lot of things that I've been working through or healing, so I think there's just like a constant kind of ever evolving. Once I really started diving more into like understanding my highest self and realizing that I do have inner gifts. I was put on this planet for a reason. Everything that happened to me happened to me for a reason. And in that, then I could pull back and release the anger with my parents and be like, my dad was just doing what he thought was best because of the information he had at the time, right? And like it just allowed me to like forgive my family and forgive my parents. And that doesn't mean that we have a perfect relationship
Yeah.
though. Like I think it's also something that I feel like to clarify, because if somebody somebody might already be struggling with their parents and working to build a relationship with God and then not be able to have that doesn't mean they're not maybe connected. Maybe their relationship and how they think about them is different, but you can't change that other person. Say if we weren't in a good spot, there's still this piece of coming to terms with something with somebody maybe that like hurt you in the past, but like they're not changing. So how can you look at it in a different way or work with your spiritual aspect of yourself to see it in a different light? Because you can't change somebody else.
Correct. But you can change the way you feel about somebody else.
Exactly.
Yes.
Exactly. I think that's a good distinction of it, though, because a lot of people blame themselves because they can't get their parents or their partner or somebody to see things in a way that they would like them to see. But it's so much of reframing. Well, yeah, those things happened, but also how can we look at this in a different light and add empathy? It's just, but if you stay in that and you hold that resentment, that eats at you for life.
Yeah, well, I think the one big lesson that people need to hear, there's only going to be two kinds of teachers in your life, period. There's direct teachers and then there's indirect teachers. Direct teachers teach you and show you what to do in life. Indirect teachers show you and teach you what not to do. And the lack of distinction and differentiation between them both will cause a lot of suffering because it's like people, like the indirect teachers are equally as important as the direct teachers. So people like come up and smack you in the face and you don't like it. Okay, well then maybe you need to learn about situational awareness. Maybe you need to distance yourself from that person, whatever that is. But the whole thing is like in certain things in life, somebody cuts you off. Well, maybe you just let more people go by or take a different road, or it's just there's always something to learn. But to the degree we don't learn the lesson, we keep repeating the teachers.
Yeah, I love that because that's a big piece too. Like when I'm going through something heavy, it's there's like really bad things that happen in the world, and I'm not saying that happened for a reason, but the way that I can look at it is be like, okay, well that horrible thing happened, but what have I learned from it, and how can I take and put some light into the world from that horrible experience? And I'm not going to be this person who says, oh, that needed to happen, so you had to have something horrible happen to you. I do not say that. It's more of what is this supposed to teach me? What am I supposed to learn from this? Because there's a lot of suffering. I believe suffering is a choice. There's a lot of pain, but in the pain is each time I go through something really painful, because I'll have people be like, how are you still going, Mary? And then, on top of all that, my brother passing, I had a friend pass away tragically, last year, and just so many things over and over and over. And it's like, well, because they're not because it's the way I'm looking at them. Like I still connect to my brother. I still connect to my friends. I still connect to people that have passed.
Yeah.
Because I believe their souls are still here. They're not physically
They're non-physical.
Yeah. And they're not physical anymore. But also these different things push me to evolve to become somebody that I wouldn't have been otherwise. Anyway, so, thanks so much for coming on. Is there anything, if you want to explain a little bit about your program so people can understand where they can find you as well.
Yeah, so we have our website, introawareness.com, and we kind of like two different aspects of our business. So we really help people one-on-one to solve the problems or whatever they're struggling in life, and they tried everything else and nothing works. We actually help them to do it in a very short reasonable amount of time. We help entrepreneurs too as well get the maximum output from what they're here to do and really fulfill their purpose. But then we also have this training. I've been doing this for 26 years and worked with, like I said, over 7,000 clients. So I'm such a systems person, and I don't like to reinvent the wheel over and over. So we put this really beautiful program of neurolinguistic psychology with a holistic way. And we teach people systematically step per step, how the mind works, the anatomy of the unconscious mind. There's anatomy of the body, but I created anatomy of the unconscious mind because the mind is not physical. No one will ever see it. But we actually walk people through to learn how they can become a better communicator, a better leader, understand how the mind works, and understand how people put meaning to things. Because we talked about trauma and triggers and things. The reality is whatever happened isn't an issue because it's gone in the past. The only thing that's holding on to it is the perception, is the programs. That's what gets repeated. That's what causes the trauma. It's not what happened. It's the carryover of what happened synthetically. The mind put its meaning to it. So if a person wants to learn how to do it from themselves or other people, that's what we walk people through. And it's such an addition to any practice. People could actually do this instead of the practice. I know like there's been massage therapists or other people in the past that to get to a certain age and like it's hard work.
Their hands.
And if you can actually help people linguistically with physical things without even touching them or doing extra work, it's great. So it's such an addition. I started that myself. I did integrated personal training. I started working with people and correcting things physically, and I can only go so far. Then I started going over to the psychological, and it released it very quickly. And I did them both together. So it is the way to go. Like you said, you're doing such a great job of kind of leading a wave for the PT and kind of trailblazing. So that's going to be really huge to be able to like just open up people's eyes to that. And I really appreciate what you're doing. And
Oh, thank you. It's scary. I've had to sit a lot in my nervous system and feel the expansion and allow the criticism to come if and when it comes, I mean, criticism comes anywhere. But I don't care, it's like, it's this really cool wave that I think we're seeing in healthcare, especially I think PTs are going to be the first wave and honestly, any movement professional, because if you've been in it long enough, they know that what we've learned isn't explaining everything. And
yeah,
so, I'll put all your information in there and so they can get in touch with you. And
I want to keep supporting you, and I'll
oh,
support anybody else, any of your people, any PT out there that's watching, and they really want to at least have a complimentary conversation to see what we do and how it can be really beneficial for them. We would absolutely love to
awesome.
talk to that. And there's a guy named Sean Ryan. I don't know if you've heard of the Sean Ryan
Mhm.
podcast. He's in Austin, but he does at the beginning. He's the host, but he does gifts. But I wanted to bring a gift for your
Oh,
podcast.
cool.
Do
That's why you brought
you,
in the bag.
yeah,
Oh,
do you eat eggs?
I do.
Okay. So I get you 2 dozen of these. These
Oh,
are Wrangle Ranch eggs. So these are really beautiful.
wow.
They're unwashed and they're unrefrigerated. You can refrigerate them. Just wash them before, because when there's how they do in Europe, but there's like a plume on it just naturally that comes off. So just wash it beforehand. Beautiful, like rainbow colored
Oh
eggs.
my gosh, that's so sweet.
And there's like cage free, they're free range. We're beyond organic, which means we have like no pesticides on our property. We don't have we have about 90 chickens, but they have like acres of land to go. So there's not like those farmhouses where they only have 1 foot.
Wow.
So it's the best. We have no corn, soy free. So it's like 2 levels beyond
Wow.
organic, and you'll taste and feel the difference. And then I just made this
Oh,
last night. This is
sweet.
my Rangel or Wrangle. It's our family recipe salsa. So we just made it last
Oh,
night. It's got a little heat. It's not
yes.
spicy, but really enjoy all organic ingredients, and
You're like, she's a white girl. She's gonna not need spicy.
it's a little flavor. It's just not too hot. It's good.
Good, cool. Well,
So
thank
enjoy
you
that in
so
good health, and
much.
thanks for having me.
Oh my
Yeah,
gosh, I love this stuff. This is great. This is awesome. Well, thank you so
absolutely,
much.
absolutely.
That was really fun.
Thank you so much for listening to my podcast. It would be a huge help if you could subscribe and rate the podcast. It helps us reach more people and make a bigger impact. I would also love it if you could join my email list, which is linked in the caption, for podcast updates, upcoming offers, and events. You can also find me on TikTok, YouTube, and Instagram at drmarypt. Thanks again.